I just stopped the video. Hello, my name is Miranda and I'll be the nurse practitioner with you today. We're going to do a cardiovascular exam. First, I'm going to have you look this way and we're going to look at your jugular venous pressure. And then look this way. Looks good, there's no jugular vein distension. And then I'm going to have you roll on your left side the best that you can. And I'm going to just look at here for your PMI. And I'm going to palpate. Can you exhale completely? Looks good, there's no heaves or thrills. I'll have you roll back on your back. I'm just going to listen to your carotid. Can you hold your breath? Okay, you can breathe. And then look this way and do the same thing. There's no bruise noted. It all sounds like everything's moving good in there. And then if you look that way again, I'm going to just palpate. And then look back over this way toward me. The pulses are +2 normal bilaterally. Now I'm just going to kind of feel around on your chest for a couple of different spots. First, we're going to find the angle of Louise, where the manubrium connects to the sternum. And then we're going to go to the right second intercostal space, which is the aortic area, and feel there. And then we're going to go back across to the left intercostal space, second intercostal space, which is the pulmonic area. And then I'm going down to the fourth intercostal space, which is the tricuspid. And then down to the fifth intercostal space, which is the mitral. And then we'll move over for the PMI, which is non-displaced. Then I'm going to take a listen to those same spots. All of those sound good. I am going to have you, I'm going to lower the head of the bed a little bit and have you turn to the left. Just a little bit. You don't have to turn all the way to the left. Just slightly. And I'm going to listen for S3, S4 sounds, murmurs or mitral stenosis, which I didn't hear on any of the other part of the exam. There's no mitral stenosis or extra sounds or murmurs. I'll have you sit up and then you'll lean forward and you're gonna hold your breath when I tell you to, and I'm just gonna listen for an aortic stenosis. And exhale completely. All right, you can lean back. No aortic stenosis murmur was heard. Now we're just going to kind of inspect your arms and legs and your peripheral vascular system, so you can just kind of relax your arms to the side. Both of the arms look equal. There's no swelling. There's no distended veins, no rashes, ulcers. I'm just going to feel some pulses here. The radial pulse is +2 on both sides and equal and normal. The brachial is also. Then I'm going to just feel around for some endotracheal or epitrochlear nodes. No nodes felt there. No nodes felt on this side either. Normal venous pattern. Nail beds color is normal. Cap refill is less than 2 seconds in both hands. And then I'm gonna look at your legs. I'm gonna roll your shorts up a little bit for me. They also look equal and normal. There's no rashes, ulcers, a couple of scrapes, but no varicosities, nothing like that. Feel some pulses. Can you bend your leg a little bit? Yep. Same over here. Okay, and then I'm gonna feel her pulse up here. All the pulses in the lower extremities are +2, equal and normal. Normally we would assess up here without clothes on, but for this exam we're going to leave our clothes on. I'm gonna check your cap refill down here at your toes, which is also less than 2 seconds. There's no signs of any pitting edema anywhere. No redness. And then we're going to, I'll have you stand up for just a second so I can look at the back of your legs too. No varicosities on the back part of his legs. The hair distribution is equal and normal. No rashes, ulcers back there. And then we're going to do a couple of tests. Just lean back, kind of relax your hands down. You're going to make a fist. I'm just going to push down here. Open your hand. Okay, do the same thing. Open. And same thing over here. Make a fist. Okay, open. Open. Both arteries on both sides, radial and ulnar arteries, both are patent and they refilled your hands in less than 5 seconds. And then they, now we're gonna have you lift your legs up to about 60 degrees until they turn pale. And then you're gonna sit up and dangle your feet off to the side of the bed. Okay? They refilled in less than 10 seconds and blood flow came back to the veins in less than 15 seconds, which is all normal. And I believe that concludes our exam. Do you have any questions?
No, ma'am.
Thank you.